Okay.
Hey,
How's
there we
life
go.
in Florida?
They're good. You're off to the side. Is that normal? Your face is way over here.
It could be the end of the day, right?
Yeah. Can you center it or not? Or is that not how yours works?
Um, how about that?
Yeah, that's better, but you're
A little
still off to the
better.
side. Yeah, how's everything going?
Well, Indiana, we just got back from the Grand Cayman, so it's not as nice here as it is there, but it's 70 and mostly sunshine, and so, you know, that's good. You guys are spoiled. You're used to that all the time, so that doesn't make any difference to you.
Well, obviously it's super hot. We've gotten the last couple of years where it comes to when it's August, we end up just going somewhere for a couple of weeks to get out of the heat because it's so bad. But
That's what I
cool.
keep telling my wife. She wants to move to Florida. I said, honey, Florida's beautiful December through March, maybe even April. And then
Oh,
it
not on the coast here. We're good from like October to now. It just
okay.
it was
Let me
actually
ask
it was actually I was wearing a jacket last week on my boat. So
okay, let me ask you. We're we are seriously contemplating a second home, and the east coast of Florida is one of the considerations. So where do we go?
everything's all of it's nice. I mean, I Cocoa Beach is nice up here. Yeah, it's gonna be where pricing what you can find because everything's expensive now. But it's like no, I mean Cocoa Beach. I love it here because I can walk anywhere to the. I can walk to restaurants. I can walk 2 blocks to the beach. I can walk to the beach bar and do whatever. Everything's close by. So yeah, it's
Okay.
pretty cool.
How about factor in cost overall?
Um, I don't know because I'm not in the market. I haven't really looked. So, but I mean, every person in this town with me is a realtor, so I can put you in connection with somebody if you want to talk to them. It seems like everyone here is a realtor. It's like I always make a joke. I think that's their last, career path, like a pinball machine. Right before it drains at the end, they end up getting a realtor's license because there's so many of them here. It's ridiculous. But
Well, I'll be down there. Well, I'll be on Venice Beach side end of May, and I'm still contemplating coming over to the East Coast. So who knows?
yeah, we were going to get together for lunch or something. So yeah, come on over and we'll go do that. At least you can see Cocoa Beach. So I'll be gone Memorial Day weekend. I'll be up in Alabama for a balloon event. I go up there every year to Decatur area,
Yeah.
outside of Huntsville. There's a pretty big balloon event there. So
Okay.
cool, man. Thanks for taking this call from me. I only take a few minutes. What I want to try and do is just like without scripted or anything, just try and catch a couple video clips of stuff. So like
Oh, that's why you want it centered. Okay.
yes, that's why I want it center because it's going to try to do that kind of stuff, and some of the AI is going to try and do some things with captions and that kind of stuff. But
Yeah.
anyway, and I'm going to edit it and cut it up and stuff. So I'll just start with, hey, Dan, how's it going? For everyone that's listening, why don't you just tell them what your name is and what you do for a living?
Sure. So my name is Dan Prater, and my history in healthcare is about 27 years. So I try not to go through all of the details, but the first 10 years, conventional medicine, and really after working in just about every department in the hospital, I sort of came to the conclusion that if you've got a medical crisis, the hospital is where you want to be. The ER is probably where you're starting. But if you're dealing with something that is chronic, or requires a certain level of maintenance, then conventional medicine is probably not the best long-term answer. So that's what led me
Right.
to naturopathic medicine. There's only two things that send you back for a doctoral. Number one, you lost your mind.
Okay.
Because one's enough. Or two, you've had a serious revelation about the direction you want to go, and that was my direction. So I've been in private practice for about 15 years, really focusing on what I would consider to be the foundation of health, which I always tell clients, number one is nutrition. I don't care what you're doing. If you're driving a brand new car and you're not putting the proper gas in there, It's just a matter of time. So nutrition's number one, supplementation is number two, and the answer is never in the bottle. So the medication and the supplements really are something short term. And the third one is going to be the regenerative medicine, and that's where the PMF comes in.
So how long have you been involved in PMF or known about it or used it in your practice?
1996, I took a trip to Tokyo, Japan, traveled to Fukuoka and Osaka. And at that time, this is 1996, so the convention was on longevity medicine. Well, if you are familiar with that time period, that was not a common
Right.
term or language. So the introduction of PEMF came in Osaka, Japan. And to say that it was a new concept would be really an understatement. But that's where it was initiated. And the interesting thing about that is that the technology they were using then in many areas is what we would consider to be the cutting edge here today,
Oh,
which is a
wow.
polite way of saying North America is conservatively 20 years behind.
Yeah, we're way behind. And I blame that a lot on maybe you agree, the Flexner report came out like in 1934 and it outlawed any kind of electrical stimulation, or it was basically if you're not doing drugs and surgery, then you got your license pulled from what was the AMA then, or your university funding, all that stuff got pulled. That's only in the US. So we're behind from all that research and stuff that everyone else, all these other countries are doing that we're not or weren't. I mean, it's starting to pick up again. So what what was the first machine that you used for PMF? Do you remember? Or is it too long ago?
Well, yeah, we're so antiquated. I don't even have that device anymore. Um, I mean, to give description to it, the application was a mat. Let's start with that. But the computer system of it was probably twice the size of your current monitor for your computer.
Okay.
Yeah. And so obviously the current mats are more streamlined today, but the concept was the same then as it is now. The mat was the main mechanism of PMF.
Okay. So on the Vibe, I know you're using it. How did you find out about the Vibe?
You know, I think we briefly talked about that. I travel around quite a bit in continuing ed, and it was specifically at a Mayo Clinic continuing ed in Tempe, Florida, or Tempe, Arizona. And one of the professors just referenced it very quickly on a slide. That was the extent of the information. It was a very quick part of his presentation. It was sort of just included in the concept of regenerative medicine, sort of under the umbrella of PEMF. But having been very familiar with the PEMF systems out there, it caught my attention, and then I just did some research and found it.
Okay, great. So what are you using it for the most? I mean, what's the top three things maybe you use it for in your practice?
You know, here's where I say to clients, you have to understand that synergy is the key. There is no one magic pill. There is no one answer to any problem. I don't care what the problem is. So number one, synergy is the key. And so with that said, the Vibe really has become just part of the protocol for anything you can think of. And I know we're not going to get into the diagnostic part, but if I just keep the language simple, it doesn't matter if you're talking about hypertension or diabetes or panic attacks or PTSD, or just pick your CPT code you want. Um, the Vibe fits inside of the current protocols we're using, and it's become just one of the synergistic pieces. So that's a long-winded answer to say we use it in every single client that we see, regardless of what's going on.
Okay, great. How many clients do you see, like a month or a year or whatever?
Well, this is another long, so you're gonna cut this out for sure. 15 years ago, the schedule was based on volume for sure. So we averaged about 100 clients a week.
Okay,
Do the math real quick, that's not possible. And what I mean by that is it's not possible to render quality care and see 100 patients a week
right,
unless you see them 5 minutes per treatment.
right.
And so unless you're God, you're not fixing anyone in 5 minutes. Okay, so after I kind of concluded that, I changed the approach and we started to try to focus on quality. Well, it was a continuing ed event. It was a conference, actually, 2010 in Long Beach, California, that I went to. And at that conference, this is 2010, one of the many subjects was the future of healthcare, which was telehealth, telemedicine.
Right.
2010, nobody had a clue what that was. But I sat through the same conference and the same information, and it got my attention, and I could see that it had application. So we immediately came back, 2013, implemented it into the office, changed the whole protocol from focusing on in-office appointments to telehealth. And so that changed the numbers in the office. Well, long story short, 2013, the goal was to see 10 clients per week in the office, and essentially segue everyone else into telehealth.
You went from
2013,
100 to 10,
well, we went from 100
110 in the office.
to really trying to facilitate telehealth.
Right.
2013. Needless to say, it was an uphill battle. It's like trying to make a snowman rolling the ball up the hill. But I was convinced, and as I say to clients, listen, think about this. You are scheduling an appointment, sitting in a waiting room, waiting for who knows how long to get into an office to spend 5 minutes with me. When you could sit at home in front of your computer, we can look at your labs together. You didn't drive anywhere, so right off the bat, I probably have conservatively an extra 20 minutes I can spend with you, and that speaks for itself. Time is the key here. So that really took a long time. By 2015, people started to understand the value of what I just said. By 2000, obviously, by the pandemic, it made sense to everybody.
Right.
So the changeover was slow, but at this point, the answer to your question is I average about 8 clients physically in the office per week, and I average close to 30 per day through telehealth, various applications. It used to be Zoom was the primary, but mainly now it's phone consults.
Okay.
Because people have grasped the whole of the concept that they don't have to physically sit somewhere. What they're really trying to do is they're trying to get information. That's why I tell clients, you spend 30 seconds in an office and you spend the other 23 hours and X minutes in your house. So the information I give you is more valuable to you than the time you sit in my office, or even for that matter, sit on a Zoom looking at me, which means
Okay.
all we need is a phone call. And so that's where it really has come to.
Okay, that's interesting. So are you doing all the phone calls yourself, or you have staff that's doing it as well? Or is there any kind of filtering levels that you're going through before they talk to you, or are you taking all of them?
Well, two answers to that. I'm not sure how I feel about AI, but I suppose to some degree it's going to happen whether I like it or not.
Right.
Yeah, the good news is AI has helped. It has helped with that process of filtering. Um, but ultimately, I talk to every single client. I try to spend that time directly with them. And you can really make a tremendous amount of improvement in someone's life if you understand that simple texting and emailing not only answers your question, but it gives you something black and white to look at at, as I like to say, at 3 o'clock in the morning when you forgot what my answer was.
Right. Exactly. Okay. So,
Um,
so when you first introduce Vibe to a patient, they've never seen it before and they're skeptical, which people should be. What do you say to them?
yeah, I love this question. In 1996, and you know this, and many people will. What type of cell phone were you using in 1996? Well, I can tell you, it was a box about,
Right.
those,
Right.
whatever. Okay. Well, if you happen to be in Tokyo and Osaka in 1996, I'm telling you right now, they had cell phones that were not too far off from this appearance. Now, that seems like a no-brainer today, but it was shocking then. The simple answer to the question is it's called technology. So the confusion people have, in this case with the Vibe, the confusion they have is really just the fact that they haven't had exposure and experience. That's what it comes down to. So I say, listen, here's the quick answer here. I'm going to show you how to use this. I want you to use it not for the next 1 hour, not for the next 24 hours. I want you to use it according to the protocol I give you for the next 30 days. If your health is important to you, then you need to first realize that there is no quick fix. So you didn't get into your problem overnight, and you're not going to get out of it overnight. So 30 days is a happy medium. And then I give them the appropriate protocols, um, give them all the patient education they really need to be equipped to use it, which means you have to give them a certain amount of follow-up options, because if they came in on Monday or they had a telehealth on Monday, by Wednesday they have a question. They need to have an answer to that question. So that's really the protocol for the Vibe is to understand the healthy skepticism you have is just simply lack of awareness and experience. And
And the
if that stops
technology
you,
and the technology, like you said, I wrote, because I get so many Facebook haters, I wrote an article on, the top 100 scams of all time. And I listed them. It's DNA sequencing, anesthesia, right? Stem cell, blah, 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 MRIs. I just go and list the top 100. Those were all complete magic and completely impossible until they weren't, right? And they're all accepted today. So that's kind of how I try to present it to people is it's, if I had a cell phone on the Mayflower, like you just showed, people are gonna go, what is it? How do you explain it to them? It just hasn't caught up yet. The technology's advanced, right? But then it becomes commonplace. So it over the 30 days and stuff. So what's some of the more surprising comments you've gotten after a couple weeks or after 30 days from a patient, maybe even ones that were real skeptical?
yeah. Let me go back a little bit to the analytical side of this. And I'm a pragmatic when it comes to this. So I don't spend a lot of time, delving into their intricate questions of explain the science to me. I tell them here's what's going to happen. You're going to get paralysis through analysis.
Right.
So politely don't waste my time and probably don't waste your money because you'll figure this out in probably honestly 2 days if you just use it. So, but with that said, I do tell them there's tons and tons of peer reviews. PEMF is not on trial here. I don't want to, belittle anyone, but your confusion with PEMF is just simply because you haven't done the trial of testing it, or for that matter, you just haven't looked into the peer reviews and the research that's out there. This is not under trial. This has been around for conservatively 50 years.
Well, I love
So
that line. This is PMF is not on trial because boy, it feels like it to me with the Facebook haters and the comments I get, and this can't be real and that thing. But you're right. It's just they're not, they haven't been exposed to it. They don't have the experience with it. And then once you do, I mean, it's like I get one example. I have a friend that had really bad asthma, and I gave him a device, and he didn't use it for 3 months. Right? He didn't even take it out of the box. And then he called me from the airport one morning and goes, are you kidding me? He ran it once. He goes, I haven't breathed like this since I was 20. I go, I gave that to you like 3 months ago. He goes, yeah, I didn't get to it till now, right? Because that kind of skepticism and this can't really work and put on the box and never even take it out, never take the cellophane off it, which was like, trying to get people. And the paralysis analysis that you just said is I just tell people is like, because then when they start to go down that rabbit hole, explain this, explain this, explain this, I go, all right, I gave you my best guess at it. Nobody knows how aspirin works either. They have theories, but you can't prove it. So just as long as it's not hurting you, try it and just see if it works for you. And so if I can get people to that stage, I've had a lot of success with that, which is just like quit trying to figure it out because, and people usually laugh when I say, you don't know how aspirin works. We don't. We have theories, but nobody's proved it. So it's just like, give it a shot. So yeah, that skepticism thing, I'm skeptical. I mean, I've been studying this for 23 years and I don't believe it, but there's just too much data that's showing that it's working. And it's like you said, it shouldn't be on trial. To my knowledge, I think Pollock says that he has 35,000 published papers in his library on PEMF, right? So that's all right, cool. So what's the what's what's the most heartwarming story you think you've gotten out of one of your patients? I'm just trying to put in that category of using the vibe.
Yeah. And I do try to stay away from isolated symptomatic miracles for obvious reasons of synergy. But to answer your question, I would say it's going to be in the area of stress conditions. If you're getting some background noise, that's my 5-year-old who's having a stress moment. Yeah, I would say in the area of anxiety and panic is kind of the most touching for obvious reasons. The visceral symptoms of someone who's under panic attack, not to minimize a heart attack or anything else, but when they get relief and they feel that sense of that pressure on their chest and that shortness of breath improves and the vertigo and the litany of symptoms that they have oftentimes goes away very quickly. Those are the stories that are kind of bring goosebumps to my arms.
Yeah, and
Now,
I've
at
got
the same time, I could tell you I've lost count of the people who have seen improvements in their blood sugar. I know that's a common one too. Um, and I could keep going with symptomatic improvements, but I always kind of try to go back to the understanding that the human body is all interconnected. You can't separate the liver from the pancreas, and the list goes on. So your symptom that you're complaining of is just simply your body's way of saying you got a problem right here. But if you don't treat the body as a whole, you will not correct that issue. And that really is, if we dig into the science, that really is part of where the key of regenerative PEMF is in treating the system as a whole.
and since we're recording it and it happened today, so I've got lots of stories that are at least heartwarming to me. Here's one in the future I hope happens because I just got off this call. So Alan Osmond from the Osmond Brothers, the music family, he's had MS for 37 years. I just got off a 1-hour call with him and his wife, and he's not found relief with anything he's tried. So we just gave him a vibe to try that, and I'm hoping that it does some. I mean, he's got his head cocked, and his muscles won't retract, is what he said. It's just like he's 72 years old, and I have my fingers crossed that works for him because we have with fibromyalgia. We've been using fibromyalgia for MS, and also in the brainwave expansion protocols now we have a specific MS one and one for neuropathy. So I'm telling him to run all 3 of them. But God, yeah, I'm hoping that 37 years and he's 72 and he's been struggling with no relief. That just I hope it does some miracle for him. So okay. Yeah, and in my story I've told this many times is a 17-year-old girl had she told me, Mark, I'll never have a date in my life because I have Tourette's. And I didn't tell her to do this. She ran the brain balancing on her own and it got rid of her Tourette's. And she goes, Mark, I have a date on Saturday night. And that was like 2 years ago. And I think she's engaged to the guy now. And her Tourette's disappeared. And I was like, I don't know how it did that, but, and that someone looked at it and went, hey, brain balancing, maybe there's a match. And that's what I mean. Every day I get tons of emails. What do I do for this? What do I do for that? Well, first, I'm not a doctor. Okay, to tell you that, but just look at the list. You're going to do the same thing I'm going to do. Look at the list and say, does this smell, sound like, feel like, touch like, does this duck look like my duck? I mean, does it feel like something that it might help me? And then try it, because I've not really had any side effects. I've had a few people on a few protocols that feel worse at first. And it's been mostly emotional ones. And I don't know if it's they're psyching themselves out or it's actually physically something happening where they're detoxing from it. Have you seen any of that? Like people detoxing from initial PMF?
Yeah. Mayo Clinic has quite a bit of research on if you want to call it the side effects of PMF. I don't like that term because they're technically not. Um, the average, I've seen a few clients with MS, as a side note, Parkinson's as well. And the MS protocol and the Vibe for me at the moment, and I acknowledge this is early in the game, I believe there are 10 different programs I run on there. And in addition to that, there's nutritional and nutrigenomic and other regenerative modalities that we use. So the Vibe is part of that. But hydrate, as you know, hydration is probably at the top of the list. If you're not properly hydrated and you're doing a form of PMF, at the very least, you're going to get probably a headache and nausea. And if you're lucky, that's all you get. So that's number one. If you're malnutritioned, which it seems complicated to some people because they say, well, I'm somewhere between overweight and I eat plenty. How could I be malnutrition? But if you're malnutritioned, and you're dehydrated and you're doing any form of PMF, perhaps even the Vibe especially, you're going to get some of these things you call a side effect. And so, other than that, really, I haven't had any complaints from the Vibe, or for that matter, any PMF, because I push the hydration and the nutrition
Okay.
as a necessity.
What's a really smart question I should ask you, but that I'm not smart enough to ask about PMF and the Vibe, PMF in general? Does anything
I,
come to mind?
here's, I don't know about smart. Here's my answer, and here's Jim Rohn's answer. My answer is a person convinced against their will is of the same opinion still. If you've never heard that, now it's yours.
Right.
Don't make this overly complicated. Do not fall into the trap of paralysis through analysis. That's probably number one. Your fear of placebo and mind over matter, and the list goes on. I reference a study from 1976, I believe, and definitely 1984, where open heart procedure was done under acupuncture, no general anesthetic. They called it barbaric, but it worked. Guess what? Today they do it on a regular practice in Asia. So this whole mind over matter concept is like throwing the baby out with the bathwater. I say this is a good thing. If your brain takes some system, PEMF or whatever you want to call it, and somehow converts that to you feeling better, honestly, this is a great mind over matter experience. The body is correcting itself. That's what it's supposed to do. Now, by the way, the PEMF is truly physiologically improving you. So it's not all in your head. So that's my answer to the smart. Don't be smart. Don't be clever about this. Don't fall into the trap of convincing, because truly a person convinced against their will is of the same opinion still. It's like the guy who spent 3 months and finally figured out on his own.
Right.
And so I don't know if that's,
No, that makes that's great. Any thank you so much for taking a few minutes to talk to me about it. Any parting thoughts or something for the listeners?
no, thank you very much for delving into this field. I think this is not your area
No,
of training. So I'm pretty sure this was not an overnight success, but thank you for
not
doing it.
even not thank you for making 23 years of researching this and really digging into it for the last 7. And my wife made me throw away the 8-foot pile of coils that are over in the corner from just the testing to try and get this right to build this thing. But and I'm super excited about some new versions of the technology I'm going to have coming out soon that are just kind of cool, I hope. Yeah, I'm I'm trying to make sure I don't get in trouble to make this claim, but I believe we're the Vibe is the fastest growing PEMF device out there. Now, depends how you measure that, right? About month, but looking at month to month units that we're selling, I don't know. I know the other top guys I've talked to, this, they're not doing percent growth like we are right now. So it's working, and our return rate is extremely low, which is surprisingly low. It's 7 times lower than I calculated it would be when I started the business. So I'm really excited about that. And the reason they're returning them is the number one reason isn't it didn't work for them. It's things like you got a money back guarantee, and I wanted to eat. It helped me, so I'm better now. So I'm sending it back. Or the mind over matter thing, they just didn't open it. I just got one today. We bought a 2-pack. I'm sending my husband's back. He doesn't want to try it. It's working great for me, but he won't open it. That type of thing, So one last story, and we'll go. Is this the PTSD protocol right now? I have a 98% success rate with it. The lady that wrote it 15 years ago got a hold of me, and she said, "Are you using the one from this blah 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 blah?" I'm like, "That's exactly what I'm using." She goes, "I wrote it." So she goes, "Can you show me what frequencies are in there?" And I showed her, and she goes, "Yep, I knew they took those 3 out. Put those back in. They're really important for this reason, blah, blah." So I put them back in there. And she told me this story. She goes, "I had a Green Beret, big, tall, gigantic guy. And he said, 'Don't you try with severe PTSD.' And he said, 'Don't you dare try and run any kind of PTSD voodoo on me, because I don't believe in any of that bullshit, blah, blah," right? And she goes, "Okay." So she ran protocols on him. 3 months later, he felt way better. He came in and he goes, "Give me your hands for a minute." And she was a little frightened. It was in her office. It's like she's shaking a little bit, doesn't know if the guy's going to beat her up or whatever, and takes her hands. He goes, "Did you run PTSD on me?" And she goes, "Yes." And he goes, "Here's what I want you to do. I want you to, whatever it takes in your career, go find out how to build a device that's affordable so every soldier can have one of these." And she goes, then the guy died, unfortunately, a couple years later from cancer or something. But she goes, "I've not been able to fulfill that promise at all, because I'm not an engineer. I don't know how to build it. I didn't have time to go hire. I just couldn't do that." And then she goes, "I discovered the Vibe." And she goes, "You actually saved my life." I was like, started crying. I'm like, so that's weird. And now I'm getting some people in the FSM community that are coming back. They're finding me now because I'm making a lot of noise on Facebook and Google. But boy, that's keeping me going. Stories like that. And so yeah, it's exciting. I just hired somebody, my first employee, a month ago, and I had to warn her. There's a whole part of the logistics of packing stuff, but you got to talk to all these people, and you're gonna people that have been kidnapped, broken ribs, car wrecks, horrific stuff that you got to try and run, relax, and balance on yourself every day, because it's because you're gonna have to deal with real people. This isn't a movie, right? There's people literally having people tell me I was kidnapped, broken ribs, kept me on heroin so I couldn't escape. I mean, one poor guy, oh my God, Dan's like, my son-in-law shot and killed my daughter, killed my granddaughter, tried to kill my grandson, shot him through the head, and it didn't kill him. We're using your Vibe. It's doing miracles for the family, but we can't afford a second one right now. Can we get one as a payment? I was like, just send them something, right? It's like, here. Yeah, I'm so sorry to hear that, but it's like, that's been pretty emotional. And that's real. I'm not, all the Facebook haters that you guys are listening, this is real stuff. We're not making this up. It's not, what'd you say? PEMF is not on trial. Though so many people want it to still be, it's not. Wake up. And I always use this example. This is my favorite example with an MRI. I listed those 100 frauds of all time. An MRI, and I'm an engineer, rocket scientist. An MRI is the most magical thing ever invented by a human being, in my mind. If you understood how that worked at the layman's level, right? Is you got protons in your body have a north and south pole like the Earth, and they're all random. You put somebody in an MRI machine, it's like 50,000 Gauss, huge magnetic field. It makes all those things line up like a laser. Then your body starts emitting its own, it increases the amount of energy that your body's releasing. Then you literally take AM and FM radio and you dial in which frequency you want and shoot it at them, right? Like 104.7 FM for your kidney and whatever it is, 116 hertz, right, for your liver, and this for your blood. Then you turn it off. You turn everything off. And when your body snaps back to randomness, it releases a ton of energy that is captured through a Fourier transform to make a digital image. That is way, way, way more magical than something that's putting out some energy to recharge your cells and increase ATP in your body, right? But everyone accepts that. We accept anesthesia and everything else too. But there's millions of MRIs done every year, and you look at the picture and go, yeah, that's my liver. Nobody's questioning how that thing just got created. So it's what you were just talking about is a technology, just don't know it. And I explained that to one of the top radiologists in the world, my explanation of an MRI. She goes, you're 98% right. Just go with that story. I was like, okay, great. All right, Dan, thank you so much for
But
joining me. This is awesome.
Mark, can I put one more detail in there?
Yes.
And you're gonna edit this, so I'll let you do with it as you please. There's that possibly one of the most unique things about that vibe is the portability. If you feel better after acupuncture or a massage or physical therapy, or for that matter, stem cell therapy, or whatever modality you did, if you feel better after that, that is probably the number one thing that separates them from that vibe is the portability. You have it on you 24/7, or you could essentially. And life, because the human body is designed for movement, it's that movement combined with that portability of that vibe that really gives it an edge over just about everything else. There's nothing else you're carrying around with you that's functioning at the level of that vibe, because of all the different programs on there. So yeah, I place a lot of emphasis on that portability.
Thank you. That's a very good point. I forget I have it on me, right? I mean, this happens a lot when I go to grab my phone out of my pocket and I pull the vibe out and I go, oh yeah, I was running general inflammation. I forgot I was even doing it. Or on my walk or whatever, you just take it with you. You can't do any of that with the mats.
Nothing.
Yeah, nothing. Thank you.
All
Very
right.
good point. All right, Dan, thank you so much. It was great talking to you today. Take care.
Have a blessed day.
All right. So I'm just going to stop the recording here.